Assalamu alaikum, hello and good afternoon. You are listening to Atiyah on the Mental Health and Emotional Wellbeing Show on Iman 1 on DAB. You can also watch live or on YouTube or Facebook. In this show, we hope to provide information that may be helpful to support your well-being and the well-being of others, because everyone's health and mental health matters. We are not here to offer you advice in place of your clinician. However, we will share information that might encourage you to seek support. If you feel you need to discuss this with your any further, please discuss it with your health and your GP or a mental health professional. This Ramadan Mental Health and Emotional Wellbeing Show will focus on Muslim women health empowerment. Our guest today is Saima. She is a consultant in obstetrics and gynecology at the Lister Hospital, Hertfordshire, with over 15 years' experience. She specialises in fetal medicine, high-risk obstetrics, and community gynecology, providing compassionate care for complex pregnancies and accessible women's health services. Saima is actively involved in digital health innovation, advising early-stage startups to ensure equity is central to new technologies. Saima is deeply committed to addressing health inequalities, particularly for Muslim and South Asian women, and works with grassroots organisations and educational initiatives to empower women to advocate for their health within the NHS. Warm welcome and Assalamu alaikum to you, Saima.
Wa alaikum assalam. Thank you for having me, Atiyah. It's a pleasure to be invited to come and talk today.
Thank you for taking your time out. Hope Ramadan is going well for you so far.
Ramadan Mubarak. It's going fine. The body got used to the fast. I mean, it's not too bad this year. So.
No, it's shorter fast, so it is a bit easier than usual. To start, could you introduce I suppose I've given you a bit of an introduction there, but could you share what inspired you to work in women's health and in particular obstetrics?
So I did medical school or medicine as a second degree actually, and it was during my third year as a medical student. I did the when you're a medical student, you're exposed to different specialities in a hospital, and I did obs and gynae where I was at medical school, and the consultant, she was quite inspirational. I remember even to this day, she was an Irish consultant originally from there and came over to the UK, and she had 3 children, and she was quite, active and, promoting women's health and making sure women get good health care. So I suppose I knew early on in med school that I wanted to do obstetrics and gynae, and I loved the rotation itself, seeing women in antenatal clinics, doing the cesarean sections, seeing the emergencies. So it was a bit of, surgery, but also medicine in one speciality. And of course, as you probably know, it's looking after 2 patients. That's the mother and baby. And I've always had a passion for scanning, which is why I ended up specializing in fetal medicine and high risk obstetrics. And so that's the reason I was exposed, why I got into obstetrics and gynae in the first place on women's health, and things later on developed from there, as we're going to talk about today.
Yeah, sure. When you think about pregnancy and birth, what does compassionate care mean to you personally?
So compassionate care is vital in women's health, especially in obstetrics or in antenatal care. So compassionate care is, as doctors, we're doing, the typical, medical, physical, examinations, taking care of that side of things. But we've got to understand that there's a person in front of you, and you've got to provide this holistic care, this continued care for a woman during her pregnancy journey, and even in her challenges in gynecology where we see women. We've got to understand the woman's background, where she comes from. We always discuss demographics of a patient as we when we hand over our patients. It's understanding what is the place they come from, especially in my antenatal clinics, so we can understand where we can then meet them and help them, and provide the input that's required. And it's also having that emotional intelligence as well as a clinician, reading between the lines, what they're saying, matching with actually what they need. So over the years as a medical doctor, I've developed my, this kind of intuition and emotional intelligence, as well as the good solid practice of medicine and obstetrics and gynae. So it's all that holistic care, understanding that emotional care that's involved in a woman's, pregnancy journey or any kind of gynecology issue she may have at the time.
Yeah, and that's important, isn't it, Saima? Where I've seen people on the other side in terms of mental health services where they've had a traumatic birth or experience during pregnancy and post-pregnancy, and as a result have been left with quite a few difficulties following the birth of their child, mentally, as well as kind of emotionally connecting with their child. Many Muslim women have unique kind of cultural and religious needs during pregnancy, don't they? And childbirth. How can maternity services better support those needs in a sensitive and empowering way?
So I'm going to talk two sides. There's a positive side where there is, organisations that are collaborating with the NHS from grassroots and the communities to provide those services to get women, from the Muslim background. One of the grassroots organisations I've worked with is under an amazing lady called Manisha Seth, called Support Me in Nottingham, where she's created, it's called Support Me Pregnancy CIC, I think.
Mm-hmm.
And she's created this Muslim village antenatal care in collaboration with Nottingham, the Nottingham NHS services, due to I'm sure you heard about the Nottingham report that came out as part of the neonatal maternity report that's on the news at the moment. So it's kind of active community grassroots engagement that the NHS needs to do within maternity services to provide and understand the cultural needs of different marginalised communities. And then the other kind of organisation that I'm with is called the Health Collective, which was set up by, I'm sure she's come on this show, Nighat Arif, and an refugee colleague of mine who was the president of the Royal College of Obstetrics and Gynae, Dame Leslie Reagan. They've set up the Health Collective where they're basically road mapping all the kind of community and grassroots organisations amongst within England, and trying to connect all the dots within it so ladies can easily be signposted to these organizations that some women don't even know that exist.
Mm-hmm.
That's one side of thing, the positive side of things I'm seeing that's happening and I'm getting actively involved in. The downside is, like I mentioned before, there is the interim report. I'm sure you've yourself and the audience may be aware of the neonatal and maternity interim report, regarding maternity care. There's still a lot of work to do. It's been highlighted. There's still a lot of discrimination and racial bias within the maternity system. And these things have been highlighted for years now. It's quite well known, the stats are that, Black women are 4 to 5 times more likely to die, and Asian women are, 2 to 3 times more likely to die if they're cared under in the UK maternity services. And out of that, there were a lot of organisations that have been born to bring awareness, but unfortunately, it has to happen at a kind of higher level, governmental level, because we need money essentially. And as everyone knows, the NHS is very cash strapped, and that's where the limitations lie to kind of bring about true improvement, especially for the Muslim community within the maternity services. So on one hand, there is some work going on. There are very hard-working organisations, individuals, but at system level, there's a lot more that is still need to be, required from top-level organisations.
Which is why the valuable contributions of people like you, professionals like yourself, would be supporting kind of that process. Is that right?
So it's really important within the NHS, and they are good at doing this, is employing doctors, midwives, nurses from people
mm,
demographics that the maternity services serve.
mhm, mhm,
I think that's really important because each place around England has their own unique demographics. And so
mhm,
it's really important to employ, healthcare workers who reflect the community they're serving. So,
mm,
for example, I worked at the Royal London in hospital in East London. So they will have link workers and community workers from the Bangladeshi community, which is, the more prominent community there. The
mhm.
Bangladesh community. So I've seen some positive actions, and they also have direct links with the East London Hospital, where they will speak to, the imams there to get some, advice if it's needed.
Yeah,
All NHS hospitals also have religious or kind of cultural leaders within the hospital, named people. So, for
yeah,
example, if women unfortunately lose a baby, stillbirth, or have a miscarriage, as in my field, we can approach these people who are there all the time within our hospital organization to provide advice of, say, if a woman, for example, wants advice on does she bury a 12-week, old fetus after a miscarriage, or can
mm,
allow the hospital to cremate it. So those
mm,
specific, as a specific example I'm providing, which I see all the time, and I've learned from that. So because I'm Muslim as well, I can provide that advice all in one as well. Sometimes
mm,
with Muslim ladies, and it's
yeah,
Ramadan at the moment, and it's been a pleasure to work with the British Islamic Medical Association, BEMA
yeah,
Association. I have made the Women's Health Ramadan series where I advise women if they are pregnant or breastfeeding. I have that knowledge on what they should and shouldn't do if they're pregnant,
mm,
they have certain conditions. So
yeah. Perhaps you could share some of that with us later on in the show, if that's okay.
we share that, and so doing things like that, and webinars as well, I've started to do as a consultant as well.
Yeah,
The other thing I've also done with Support Me, the Nottingham organisation, I did a webinar basically on cesarean sections for women, Muslim women, and just letting them understand what the process is of going for a planned cesarean section.
mm,
So, these kind of things at an individual level, but also organisation at a local level and regional level, and like as I say, national, is all important at all these stages to
yeah,
allow our Muslim ladies who are pregnant or who have gynecology issues to engage with the NHS. But they need to have, as I say to my patients when I see them, is they also have a responsibility to engage and
yeah.
educate themselves about these things if those opportunities are put before them.
Yeah, and asking the right questions is important. And many people from different cultures, varying cultures, might not have the words to ask those questions. I wanted to kind of just build on some of what you said earlier. You talked about statistics around Black women being 4 to 5 times more likely to die, and I read in a recent report about people assuming that Black women's pain threshold is much higher, and some kind of stereotyping and assumptions that are being made by staff, perhaps in the NHS. And I'm just thinking about what are the common misconceptions about Muslim women's maternity. I mean, we're focusing more on Muslim women within this show, but we know that when we think about Muslim women, there's a whole kind of it's across all kind of diverse
Yeah.
communities, isn't it? Do you feel that they need to be challenged, some of these misconceptions? What would you identify them as, or what have you read in recent reports?
So, I mean, it's exactly what you've stated. That is a typical thing that, patients who have utilized the NHS services from the kind of Black and Caribbean African community have stated. For South Asian women, it's the Begum syndrome, or the Indian princess syndrome. So these are these labels that have been highlighted,
Yeah,
in the report that are still unfortunately being, there's this unconscious bias in healthcare workers. I mean, where I'm working now, When I was, when I was taken on, when I did the interviews, they recognized that the demographics of their community is changing from a majority white British, kind of poor deprived area where they're now seeing people from different backgrounds coming to their hospital using the maternity services. And so they had this drive to employ, doctors and midwives, like I was saying at the beginning, to reflect the patients that they're treating. And I think it's important because I, as a Muslim woman, will understand the nuances of a Muslim patient at the end of the day that my, very good, English colleagues may not understand. And then having those conversations, as colleagues as well is even a good thing. So then they get to understand that, why would women fast when she's pregnant? It's not good for them. Well, they have a spiritual obligation. They feel like they do. Those are the kind of conversations I will have with colleagues. And so this is why it's important, I say to my younger generation, please, get your education, get into those professions as well, because, it would be a form of sadaqah jariyah because you're then helping Muslims that you'll be treating, in a country that doesn't really understand, the nuances, the needs of a Muslim lady in pregnancy, for
And
instance, yeah.
sure, and that's important, isn't it? Because being culturally sensitive, it will improve safety, won't it, and well-being and kind of trust for mothers and babies, and that's important, isn't it, for the whole journey of maternity.
100. Trust is one of the biggest things you need with, the patient healthcare worker relationship. The patient needs to feel that she can come to you and, tell you about anything. Okay. So in maternity care services, we try to do this thing of continuity of care due to the restrictions, of, the maternity service not being so great. This doesn't happen so much. And so we see examples of breakdowns in relationships and therefore communication, which in turn can lead to bad outcomes. Unfortunately, the most people affected are marginalized communities. That is Black, Asian, Gypsy communities. People, marginalized communities are the ones that end up suffering. Uh,
Mm.
so it's important to be aware of that. So there's now a lot of awareness where we talk about ethnicity about our patients. So we understand that there may be extra needs, which I think is good. Because the workforce is still majority, white, English, British, which is, which is expected. But then they subconsciously will then have to make that self, they have to become self-aware, that there may be things they may not understand about this patient. So things are moving forward since I started training, which is a good thing.
Yeah. Um, I mean, health inequalities, like you say, do kind of remain a major issue, don't they? Not just across maternity care, but in many fields, perhaps healthcare fields within the NHS and beyond. But and you've talked about some of the steps in terms of overcoming these inequalities. Is there anything you wanted to add to that? And I'm also thinking about when pregnancy becomes kind of complicated and the emotional impact being quite overwhelming. What support makes the biggest difference for women in those moments?
So that continuity of care makes the difference. Having the same obstetrician, the same midwife throughout your pregnancy journey. We do this quite well with our perinatal mental health patients, actually. The severe cases, definitely, where they have one person assigned or one midwife assigned to them, where a contact number is given or an email, and the patient, will speak to them about any issues to help them navigate the pregnancy journey, specifically if we're talking about that. So the maternity services around the country are doing really well because most of the units that I've heard about now do have perinatal mental health teams. So when I started as we were junior doctors then, we're resident doctors, we called them resident. But when I was a junior doctor, I had a passion for perinatal mental health as well. So I've specialized in that and I've trained in birth trauma training as well, which I'll talk about later. There was no specific perinatal mental health care within hospital units. I remember that. And then eventually, as the awareness increased, because we have we have the triennial reports, where they categorize what is the the biggest killer of mothers in England.
Mhm.
And I can't remember the year's report, but it was, suicide was the number one killer of mothers, after birth and 6 weeks post delivery as well. So that when they saw that, there was a lot of work done by organizations, um, uh, to, bring awareness to this. And I always worry about marginalized communities, especially Muslim communities, who still aren't utilizing perinatal mental health services. It's still, the typical English, quite articulate lady who's utilizing the services. I'm not seeing that diverse usage from marginalized communities still, which is unfortunate. And maybe it's because they're not aware of it, or they've not articulated they need it. And that's where, as healthcare workers, we need to figure out, does this lady seem like she needs to have it? But it can be very difficult, especially with language barriers, which is something we haven't talked about now.
Yeah, we'll pick up on language barriers shortly, but also thinking about the mental health impact on women, and the support that's available for them after the break, if that's okay, Dr. Saima. Um, we'll break here for a couple of minutes. See you on the other side. Jazakallah for tuning in. Assalamu alaikum, welcome back. You're listening to the Mental Health and Emotional Wellbeing Show with Atiyah Ali and our guest, Dr. Saima Sharif. And we were talking about women's empowerment, health empowerment. In particular, we had come to the point where we were thinking about mental health, and birth. Dr. Sharif, if you don't mind, could we move on to thinking about language barriers and thereafter understanding kind of emotional well-being?
Yeah. So language is obviously a rather a big challenge. So I did my obstetrics and gynae training in North and East London. So while I was training there for nearly over 10 years, I saw lots of different populations, different languages, especially in East London. I worked at a hospital called Newham Hospital, and nearly, I think, over 70% of people didn't speak English there. So you could imagine what the challenges were at a hospital doing like that. And one of the solutions are using things like Language Line. So real time translators available on the phone and video call. And the advantage of video call is that the patient was able to see someone talk with the facial expressions, etc., which is advantage for that.
Mm-hmm.
The advantage is having healthcare workers who speak the language. So I can speak, obviously, I come from, my parents, grandparents originate from Azad Kashmir. So not only can I, speak Urdu, which easily kind of, you can speak Hindi then. I also speak Punjabi and a dialect known as Bahari. So while I was working there, it was so advantageous to use that because a lot of the population there is South Asian.
Mm-hmm.
And I remember a colleague saying, that was, we dealt with a poor lady who came in with bleeding. She was 16 weeks pregnant. And unfortunately, she had a miscarriage and lost the baby. And, both the couple couldn't speak English and they spoke the dialect I actually spoke. And so I did the consultation. We offered the condolences and the process all in my language, which is Bahari. And my colleague who obviously couldn't speak that, and it was good feedback when you're in the situation, you don't realize, but she said that was absolutely beautiful, the way you just spoke to them and described complex medical processes and what would happen afterwards to them. I could just see they were eased. So this is why it's important to kind of employ people, to reflect the demographics they serve, which is what I was saying before.
Mm-hmm.
really, needed that, and that's another solution of overcoming language barriers. The other one is link workers. So I worked in a North London hospital called North Middlesex Hospital, and there's a Turkish Cypriot community, and I don't speak that language. So we had in-house link workers. So every time we had, a lady presenting with an emergency or a kind of complex medical, information that was needed, we had these link workers who had years of experience of knowing how to explain medical terminology into Turkish Cypriot, which was really advantageous. So
Yes.
our hospital units and maternity services who recognise the challenges they have within the units and do provide solutions. But unfortunately, it's not the same in every maternity unit. And so it can be patchy as to what you will get if you don't speak English. So it's
Yeah.
overall a challenge.
It does seem like it's a challenge, doesn't it, if certain NHS bodies provide that and others don't, especially when you're living in an area where there might be less diverse communities. And I suppose for opportunities like that, you've got the access to kind of the health collective, or is that a separate organisation that's more road mapping? And you talked about support me pregnancy, was it?
Yeah, so these are grassroots organisations and national organisations outside the NHS. So it's important to know what they're about. So then when I see a patient, I can say, well, why don't you go on their website? They can, I can signpost you to someone in your area. So that's the purpose of the Health Collective. They're trying to roadmap
Mm.
these amazing community and, grassroots organisations so they get to a point where they can signpost people within their relevant regions. I think that is one of the goals
Fantastic.
of them. But the other organisation that I'm also with in regards to birth trauma and mental health, I'm sure we'll talk about it, is Make
Yeah.
Birth Better as well. And so that's an organisation I will always signpost my ladies who have suffered any birth trauma uh,
Mhm.
to
Apologies, I think I missed what did you say what it was called, sorry?
make birth better.
Make birth better. Okay.
About
Um, so we will move on to talking about kind of birth trauma, if that's okay. I mean, we often think of trauma as being physical, which it
yes,
obviously has that component, but emotional trauma after a difficult birth can also have a deep impact. And before the break, you were talking about kind of depression and what that might lead to in people who've had traumatic experiences. What are the early signs that you look for that a woman might be struggling after birth?
so I think it's very important that I explain that I have actually been trained in birth trauma. So as a trainee, I did something called the rewind technique to do with birth trauma and how to treat it. And part of that was recognizing symptoms. And as I mentioned, I'm also part of Make Birth Better, who do training courses on how to recognize
Mm.
people who may have birth trauma specifically, not depression or anxiety, but birth trauma. And typically, what it tends to be is a lady returns for her second, third pregnancy, subsequent pregnancy, and the delivery before they've suffered trauma. And specifically, you can see when a couple comes. I had one a couple of weeks ago when they were recounting what happened in their last delivery. When I said to them, "Oh, why did you need a cesarean section? Why was it emergency?" You could just see them looking into their mind and just
Mm.
with anxiety of what happened. And then when I recognized that, I then delve and I said, "Well, typical things you'd ask is, well, did you have nightmares? Did the thoughts about the delivery go beyond the 6 weeks?" I'll talk about the importance of 6 weeks postnatal, recovery. And if they say yes, it's most likely they have birth trauma. And so the women or the couples that come, they were like, we had to leave the last hospital because we get triggered every time we drive past the hospital, for example. Is an So that's a kind of full on emergency C-section that a lady would be triggered by. I also need to just highlight that, if any lady is listening and they are triggered by this, which it can be, I should have said this before, but, do seek help. If me talking about this is, making you feel something, then it's likely they have birth trauma. And like I said, Make Birth Better is a good organisation to signpost to get help. I just want to talk about how birth trauma doesn't typically present with having, where the baby's heart rate goes down and they needed an emergency section or, an emergency forceps, instrumental delivery. Is who is in labour, first time mummy, first time labour, and the midwife literally just pops out for 5 minutes to maybe get some medicine. And that a lady has described being left in a room for just that 10 seconds, minute, traumatized her. The fact that, she was left alone, didn't know what to do, the partner who's in there doesn't know what to do, that can even be birth trauma as well. So it's important to recognize the birth trauma is a very individual state a woman will develop depending on what she was feeling at the time. So it's very important to recognize that and pick that up in our clinics, so then we can get them help. That is to refer them to the perinatal mental health team, or we have the local referral pathways to get CBT.
Okay. Can you tell me a little bit there about, you've used the word acronym CBT, we'll come back to that in a second, but I'm just thinking about making birth better, Make Birth Better. Is it a national or a regional initiative? And because we're based in the West Midlands, I'm just wondering.
So it's actually a national organisation. So there's groups who are then come under the umbrella of birth trauma, of Make Birth Better. So they basically get all these organizations to come together to get, to the individual lady or couple's experience of maternity services, and use all their voices and then create reports and then present them at the parliamentary roundtables they have, to try and improve and say, look, this is what's needed by maternity services. We need this to help. So that's one thing they do. They also signpost you to health professionals who can help with ladies who have birth trauma as well. So if you need to speak to a psychologist or a talking therapist, then they can signpost you to that. They also campaign. So, for example, they were campaigning on how much was needed to improve maternity services. I can't remember the figure, but they were saying, look, to the government, we need this much to, improve mental health services within maternity. Please, can you provide us? And they will provide papers. And then there's the research side as well, where they, do funding and co-create research. So they can, highlight the impact of birth trauma, so better care can be, provided for women. So there's kind of different arms to the organization, and it is a national organization. And if you just type Make Birth Better, on Google or on Instagram, it's Birth Better, I think it is. That you can get lots of information, and it's not just a just like I say, for English speaking people, they have a powerful voice for marginalized communities, where they engage with grassroots and community organizations to get the voices of individuals, so then to highlight the needs of certain marginalized communities, including communities.
Yeah, and that's important, isn't it, for communities, Muslim communities in particular, because faith, family and community play a huge role in women's lives, doesn't it? How can healthcare teams work sensitively with these influences to support women's mental health well-being?
How can they, can you repeat that, please?
Yeah, how can healthcare teams, do you think, work sensitively with these influences? So we're talking about faith, family and community to support a woman's mental well-being rather than letting it become a barrier.
So, like I said, having engagement with the organizations in their local areas would be one thing. And then the others would be also engaging with local community leaders and making sure that the community become aware of, for example, mental health and pregnancy. So, BEMA, the British Islamic Muslim Association, they actually go to mosques to educate, community leaders there and say, look, this is a problem. And, for example, they did I think they were doing life savings, the basic life support, for example. So they would go around the mosques and train them on what to do if a relative or, someone becomes poorly or has a cardiac arrest. This is what you're meant to do. So programs like that are really important. And healthcare workers, BEMA is basically healthcare workers, and they're engaging with the communities. So then there's this link between, say, that lady who has mental health to then come into the NHS services because organisations like Health Collective, BEMA, are advocating for her, and then she can then, via translators if needed, etc. They can approach the NHS services and ask for what they need, specifically mental health needs. There's
Hmm.
there's an initiative in East London called Maternity Mates, so which was brilliant. I actually sat in a clinic with a Bengali lady, um, and obviously couldn't speak, and a lady from who's a volunteer who works at this organization who had delivered at that hospital came with her to advocate for her because she'd been through the healthcare process and didn't know what to do. And so she was there to advocate for this lady. And the other popular thing is doulas. So there's a trend I'm seeing, of people like, I've worked in North London, there's Jewish doulas, there's in East London there were, Muslim women doulas as well. So they understand the cultural and religious nuances needed during the delivery. And so a lady who can't speak English then can use them. So doula is not a qualified midwife. They kind of are there to support the woman to help her make choices during the delivery because labor is a very intense, very emotional time, and a
Hmm.
doula will be there to speak for the lady or the couple because obviously this is all new for the partner, and then they will speak or advise and say, look, for example, hold on a minute, do you really want to have cesarean section or do you want to carry on? So it's just those kind of, it's a person that's there to make sure the woman is being heard, especially if they can't speak English, and is getting, her birth choices, in a kind of calm manner. So some doulas are amazing that I've met. But there's some doulas who can be quite obstructive as a healthcare worker. So it's a pro and con both ways, but it is one there to advocate for the pregnant lady, especially in a very emotionally intense time like labour.
Yeah, of course. I mean, it does sound good having a doula present or the option of having an advocate to speak to. But some advocates might find it quite difficult to support people or a woman processing a frightening birth experience. I mean, I'm not forgetting the partner in all of this who might also have, suffer from trauma when being present at the birth. But we talked earlier about kind of mental health support. How often are people referred to mental health services? You talked about CBT being cognitive behavioural therapy. Are they perinatal specialists in that field?
So we would, as soon as a woman is pregnant, she comes to a booking appointment and she will see a midwife and they will screen the lady. And if they deem her to be high risk of, having mental health issues, i.e., a lady's got schizophrenia, a lady's got bipolar, severe trauma from the previous delivery, they will then be streamlined and be referred to the hospital perinatal mental health team. Once they're within that perinatal mental health team, they then are able to access a psychiatrist, psychologist, a specialist, a specialist perinatal mental health midwife, and
Hmm.
an obstetrician like myself who specializes in perinatal mental health as well. So the whole team, the MDT, the multidisciplinary team, will be there to provide the necessary input for whatever the mental health requirements are of that lady. And that's only if it's been made aware. Sometimes women are picked up along the pregnancy journey. For example, they may see a community midwife, and the midwife is picked up that the lady's struggling and she's saying things like keywords. So when we're trained about mental health and trauma and anxiety and depression, there's certain keywords and things like women will say, I'm not going to be a very good mother. Those are the kind of phrases we look out for. And what we would do straight away is we would say, look, would you like, with their consent, can we refer you to the perinatal mental health team? Once they're in that, they would then, have an appointment with the psychiatrist, psychologist, whatever's required, and then they will refer them on for talking therapies, as we were saying. If they need medication, they would report on medication, or, they will need cognitive behavioral therapy. So, like I say, we have trained, very specialized mental health professionals who can deem them and then refer to the appropriate requirement that's needed. Not only do we just look at a medical level, remember at the beginning I was saying we look at holistically, we also look at what the lady's support is at home, who is there with her at home. Now we face a situation where even within the Muslim community, there's a nuclear family situation. We're not in our extended families the way I was brought up. So we need to recognize these things, and the other things like we've talked about already, language barriers, the cultural, nuances that this lady has, being open with them. And midwives are amazing, especially the ones that see, community midwives. They will get a lot of information out of women as they develop a relationship with seeing them. So, like I say, the referral system has improved, but there's still a lot more work to do, I would say, especially for marginalized communities, and especially within my Muslim community. I'd like to see more ladies utilizing these services.
Yes, it's even more important to be kind of familiar with these services, especially if a person cannot speak English and it's not their first language. If somebody could advocate or signpost women to these services, that would be really helpful, because at times mental health goes unnoticed within marginalized communities. Have you found, I mean, you did say that at some point people did not recognize that they had any issue, and there's certain phrases that you look out for. Do you find that people are receptive to that and recognize that they're feeling a bit apprehensive or anxious about becoming a new mum, let's say?
So, as a healthcare worker, to recognize those cues.
Yeah, I mean, not just recognizing them, but do you notice that people are receptive to that? So they'll want to engage with services, or they're open to the discussion?
So, for example, I, over the years of practicing now, have seen, for example, women presenting with abdominal pain in pregnancy. And one of the things I noticed that if they've presented more than 5 times, there's definitely, and everything's always fine. The baby in utero is fine, and mum's, observations, examination, bloods are all fine. It's usually a cry for help. And then when you say, look, is everything fine at home? The women do release, and they do tell you in the end. They they're happy that you've recognized that. And sometimes it's not that we've got to meet them where they are. That's what we've got to understand. The compassionate care we were talking about right at the beginning. We have to meet them where they are. And so, yes, when you say, look, do you need help? They will usually say, yes, I do. I am struggling. And then we will get the relevant teams to, help within the, antenatal maternity services.
Thank you very much. It's been a pleasure talking to you about women's health empowerment. And I think it's really important to understand what kind of questions to ask when you're a new expectant mum. Do you have any simple well-being or self-care advice that you think you'd give to new expectant mums, or to help them navigate kind of the physical and emotional transition?
I mean, I would say engage with the services. Whatever need you have and you feel you need it, just ask them. And if you have a language barrier, bring someone with you as well. There's, like I said, there's these organizations like Maternity Mates, it's not everywhere. Or bring someone who can speak English, who can articulate that for you. But don't back. There's no kind of judgment, nothing like that within maternity services. The nature of the healthcare workers, landscape has changed now. You find someone who is able to help you. So be very open and engage with workers. And
Yeah. Thank you, Dr. Sharif, Saima Sharif. I mean, there's loads more questions that I had planned to ask you, but it's been so informative, and I've been listening to you, and I'm sure that other people will be also sharing the same experience. I've seen you on social media. I've seen you share lots of insight, and I'm sure people want to know where they can catch you or find more information generally.
So on LinkedIn, it's Miss Saima Sharif, and on Instagram, it's Dr. _ psychology, which means obstetrics and psychology. So it's Dr. _ psychology on Instagram, and Miss Saima Sharif on LinkedIn. And I'm happily, be approached to give webinars or talks or help, during the Ramadan month, especially.
Jazakallah khair. Do you have any messages, a final message that you want to leave our listeners with? You've got about a minute to share.
I hope your Ramadan is blessed and your family, is protected, and all your fasts be accepted this year. And thank you so much for listening to me talk today.
Thank you very much for giving us your time. We didn't go on to speaking about breastfeeding, but I'm sure if people find you on LinkedIn and on the social media handles that you mentioned there, they'll be able to seek some more information around that, and perhaps on Make Birth Better, etc. You can listen back to this and previous shows on Ramadan Radio's Wolverhampton YouTube channel. This will soon be evolving to Iman 1. Jazakallah for listening in. You can find me every Saturday at 1 o'clock on the Mental Health and Emotional Wellbeing Show.